The Healthcare Security Cast is sponsored by 3D Network Technology. www.3dnetworktechnology.com.
Welcome to the Healthcare Security Cast, the podcast dedicated to healthcare security, safety, and emergency management. If you are involved with a healthcare security program or desire to be, this podcast is for you. Join the conversation as we discuss the issues that matter to healthcare security professionals while leveraging the expertise of healthcare security thought leaders and experts in personal development. And now, here's your host, Brine Hamilton.
Welcome to the Healthcare Security Cast for Thursday, April 9th, 2020. Welcome to the Healthcare Security Cast for April 9th, 2020. I'm your host, Brine Hamilton. I want to remind all of you to connect with us on social media. We have a LinkedIn group, the Healthcare Security Cast community, and a Facebook group as well. Also, feel free to connect with me directly. My name is Brine, B-R-I-N-E, Hamilton, and I'm the only Brine Hamilton on any of the platforms. You can connect with me on LinkedIn, Facebook, Twitter, Instagram, and TikTok. Now for today's show, we're joined by Jesse Hernandez in a conversation focused on access control in a healthcare setting. Now, let's get into the show. We're joined by Jesse Hernandez today. Thank you for joining us, Jesse.
My pleasure, Brian. Thanks for having me.
To start off, let's talk a little bit about you. Who is Jesse Hernandez?
Yes, sir. I'm a 36-year-old Mexican American who resides in El Paso, Texas. I'm the proud father of three. I was born in California and raised in Compton during the 90s. Currently, I'm the security manager for two different hospitals, the Hospitals of Providence Trans Mountain Campus and the Hospitals of Providence East Campus. I'm also the patient transport manager for the Hospitals of Providence East Campus. I'm originally from Los Angeles, California. I've called El Paso home for the past 6 years.
All right, great. And you have a unique story of how you got into this industry. Would you mind walking me through your career path and what got you to where you are today?
Yes, sir. My career path to the security field was a blessing in disguise. It started off on the campus of El Community College at Torrance, California. I had finals during the week of May 2003. I had all of my study guides inside my car. As I completed one finals, I walked back to my car to grab my book so that I can study for the next finals. I walked to the parking lot and I couldn't find my car. I looked over and over again for my 1985 Monte Carlo. I was unsuccessful in locating my car. I walked back to campus to file a police report. After I completed the police report for a stolen vehicle, I waited for my wife to pick me up from campus. A job fair was taking place at the campus. Out of curiosity, I stopped by the Securitas booth. I always had a desire to become a police officer, so that I thought I would work security as a bridge to law enforcement. Also had to work so that I can save money for another vehicle. Securitas sold me on the security journey. They provided everything for me. All I had to do was drive 40 miles from Compton to Pomona, the courthouse. No one else wanted to make the hour-and-a-half drive, so I decided to take the job. I am thankful to my wife that she supported me during the commitment. My wife drove me to work and picked me up during the process of purchasing a new vehicle. My wife sacrificed almost 6 hours per day. Thank you, Wendy Hernandez. At the courthouses, I learned the fundamentals of access control, X-ray scanning, and metal detectors. After months passed, I was moved to a courthouse closer to home. Before I knew it, I was offered a position as the armed field supervisor for the Los Angeles Sheriff's Department account. My branch manager told me that my patience and determination was rewarded. I spent 2 years with Securitas and learned client relations, customer service, post-inspection, security agreements, and statement of work. My wife was expecting, and I was seeking an opportunity that would present the best benefits possible for my family. During that time, my childhood friend worked at a level 1 trauma hospital in Long Beach. He would tell me countless stories. I was intrigued, so I applied for the public safety officer at Long Beach Memorial Medical Center. I worked at Long Beach Memorial Medical Center until 2009. I became the security manager for Community Hospital Long Beach. I learned how to become a leader, and I have worked in healthcare ever since October of 2005.
Do you have any mentors, and how have they impacted your growth and your career progression as well?
Yes, sir. My very first mentor was my director of public safety at Long Beach Memorial Medical Center, Joe Cruz. I learned how to become a leader thanks to Mr. Cruz. I'm going to share with you a quick story regarding Mr. Cruz. I worked the night shift from 10 p.m. to 6:30 a.m. Mr. Cruz would come in at 5 a.m. to sweep cigarette butts from the floor at the entrances. I would always wonder why my director was sweeping cigarette butts. So one day I asked him, "Why are you sweeping cigarette butts, Mr. Cruz?" He told me he did not want to burden the security department because it was not on their job description. He also mentioned that he didn't want to burden the housekeeping because they were busy cleaning patient rooms. He said he could wait for the grounds crew to pick up the cigarette butts at 7 a.m. or he can pick them up sooner so our patients that were arriving at 5:30 a.m. wouldn't see the cigarette butts on the floor. I was amazed. Mr. Cruz cared about the hospital image so much that he was willing to come in at 5 a.m. to sweep cigarette butts. I offered to sweep the cigarette butts, but Mr. Cruz declined my offer. I felt embarrassed, so I started sweeping the cigarette butts at 4 a.m. so that Mr. Cruz did not have to sweep them. My second mentor is my current Chief Operating Officer, Eric Casares. He started his career path as a registered nurse and worked his way up the nursing org chart from director to Chief Nursing Officer. Now Mr. Casares is the COO for the Hospitals of Providence East Campus. He has taught me that you can become anything you want as long as you set your mind to and become the best version of yourself. I often see Mr. Casares walking down the halls. He will greet everyone that passes by him. He will pick up trash from the floor, and he also rounds on patients. Mr. Casares inspires me, and I am thankful to have him as a mentor.
Given the current events, Jesse, I'd be remiss not to ask how your facility is being impacted by COVID-19.
Yes, sir. The Hospitals of Providence is focused on patient care and patient and staff safety, therefore has implemented visitation restrictions to reduce the number of visitors at bedside to 1 per patient. Security is instrumental in helping with access control. The security team is tasked with health screening of all patients, visitors, and vendors entering our doors.
The other thing, too, we've seen some pretty innovative practices that some organizations are doing to just to address the challenges with COVID-19. Are you guys doing anything unique to help deal with the challenges?
We are, Brine. Currently, we have our tent set up, and we're diagramming plans for drive-in park screening. Our security team is tasked with traffic control and access control during the exterior screening. Drive-through screening will allow the patients to remain in their vehicles while our amazing staff perform screening.
Excellent. Now, the main topic for our discussion today is access control. And this is obviously a topic that you're pretty passionate about. So what is it about access control that captured your interest?
I think access control is very important. I break it down into 3 components. Component number 1 is, how do you contain the perimeter to your organization? Do you post security officers at your entrances or exits? Can you lock down your entrances or exits? Do you have barricades at your entrances or exits? Component number 2 is access. Who determines access levels for your organization? Do you have a sensitive area policy or plan to identify who has access to areas like the server room, pharmacy, medication rooms, medical records, administration, human resources, hot labs, etc. Component number 3 are your reports. Is someone reviewing card activity live as people are swiping into badge readers? Or is someone reviewing activity reports to identify doors held open, doors forced open, card holders attempting to badge into doors that they do not have access to?
What are some of the practices that you've implemented across your facilities around access control?
I have the luxury of being the startup security manager at the Hospitals of Providence Trans Mountain campus. It was a brand new hospital, so I think everything started with policies and procedures. It helps keep order so one doesn't assume that the security leader is making up who has access and who doesn't. We have policies that establish the department director responsible for determining who has access to their department. Also have a sensitive area policy that identifies access control measures for those departments. The department leader signs off on the policy as well as the safety officer and myself. We use the Environment of Care Committee as a platform to evaluate our areas of improvement. The EOC also measures our policies to ensure that we are fulfilling the needs for the department in regards to potential use of physical security, such as badge readers, CCTV, and/or panic buttons.
Right, and from your perspective, what are some of the threats or vulnerabilities that you see in healthcare facilities as it relates to access control?
Yes, sir. In my perspective, I would say the biggest threat is infrastructure. Is your hot lab secure if you're storing isotopes? Is your main power supply secure? Are your generators secure? Is your server room secure? Is your labor and delivery department secure? Who's reviewing access levels? Who's reviewing doors held open? Who's reviewing doors forced open? Who's reviewing your contractors or vendors that are entering your facility and potentially accessing these areas? I would say infrastructure would be the greatest vulnerability.
All right, now as far as technology is concerned, what technological advancements do you think will have the greatest impact on access control moving forward? Or I guess what technology do you just find interesting?
I think it comes down to the leader knowing their system. Currently, we use Software House, Secure 9000, and Genetec for our surveillance system. And I think the greatest advancement is the capability between your access control system and your CCTV system. And they communicate with one another. Do you have camera calls for your panic button activations? Do you have camera zoom-ins for your doors if they're forced open or held open? So I think knowing your system, a lot of times, Brine, we rely solely on our contractors, our vendors, our IT department to maintain our physical security elements. But if we were to invest our time in learning those security elements, I think it would help our overall security management plan because we would know how they work with one another.
All right, and you mentioned the system that you're using now, your Secure 9000 in conjunction with Genetec. What are some of the technologies that you're leveraging on that platform?
For those technologies, we have camera call-ups. So in the event that a panic button is activated at one of our nursing stations, inside our security office, we have a camera that will roll up. During the process, we have a strobe light and a siren that will be engaged. This will allow the security to send a security officer to the area that was impacted, as well as have instant video feed of the area that's impacted. That way we're able to see from the outside looking in, and we're able to lead our responding officer to the area, and they understand what they're facing prior to arriving. In the event it's a disgruntled patient or a visitor, security is already aware prior to them arriving.
Right. And do you have an example of a situation where using this technology actually helped you prevent an incident or it helped with the response process?
Yes, sir. In adding the system to where your access control speaks to your camera surveillance, what it does for us, Brine, is it helps us with a proactive state of mind as opposed to reactive. So a lot of times we hear complaints. Someone entered this area. We are missing items from this area. And some of it comes down to doors forced open, doors held open, people entering the area with a master key, people holding the door open and taking supplies from the area. So we have our call system for Genetec. When these areas are forced open or held open, it pulls up the nearest camera. So security sees the area, and they're able to send a security officer there and investigate why is the door being forced open, why is the door being held open. So in doing so, it reduces our response time from having to investigate after the fact. So we're being more proactive in doing so.
Okay, awesome. And you mentioned you've had the unique opportunity to be a startup security manager and kind of build your program from the ground up. Is there any advice that you would offer to someone in the same shoes that you were in a couple of years ago?
It was the best opportunity that I've had in my career, Brine, to be able to start from scratch, build your own team. One of the opportunities that I had was I interviewed every single person that I brought onto my team. We had meetups before we started outside of work, so everybody was able to get to know each other. And I think that was an icebreaker because it helped us know each other outside of work, know each other on a personal level prior to us knowing each other on a professional level at the hospitals. Also in doing so, I was given the opportunity to review our physical security and look at what the best practices are. One of the things that we implemented was multi-class badge readers. And the purpose for multi-class badge readers was a multi-class badge reader allows a badge reader to read 10 different card formats. So we have 4 hospitals in our network with the hospitals of Providence. So I'm able to allow badge access from other hospitals with their card into our hospital. So in doing so, we're able to increase physician satisfaction So we're not issuing so many badges to our physicians, and a physician could use one badge to access our hospitals.
Oh, so yeah, that's some great technology. Now, actually, one thing that you just made me think of, just as far as resources, because obviously a lot of this was new to you when you first started, and I know you're a new member to IHSS, so you wouldn't have had access to those resources at the time. But what were some of the resources that you leveraged when you were, just kind of finding your way as a manager?
Resources, IT. I think knowing the IT department and how your physical security works, whether it's something as simple as what kind of cables are you using? Are you using Cat 5, Cat 6? How are you running your cables from one source to the next? The IT department was instrumental in helping me grow because I learned things from the infrastructure side, physical security side, as well as knowing the fundamentals from a uniform security side. So I would thank the IT department, and I would recommend that you get to know your IT department.
Great. Now, is there anything else that you'd like to highlight or point out that I haven't asked you about yet?
I think the opportunity of joining IAHSS is great because it opens up opportunities for networking, for resources, for sharing the knowledge. So I would recommend, if you have the opportunity, look into some of these organizations. Great.
And, I had the pleasure of connecting with you, and I mean that. It's been a pleasure, meeting you through the LinkedIn platform. But what is the best way to reach out to you if anybody does want to connect with you after hearing this?
LinkedIn is a great platform. Like you mentioned, Brine, we're able to connect on LinkedIn, and we are able to keep in contact through LinkedIn. And it opened up the opportunity. So the other opportunity is my direct hospital email. It's jesus3.hernandez@tenethealth.com. If not, you can reach me on LinkedIn as well.
All right. Well, excellent. Jesse, I thank you so much for the time. Again, we've had some communication on LinkedIn for a couple of years now, so it's nice to actually put a voice to the name and the face. And hopefully through our work, we'll be able to meet in person at some point.
Yes, sir. That'd be great. Brine, I thank you for the opportunity. It's been a pleasure.
And this concludes another episode of the Healthcare Security Cast. Join us next time when we have a new guest and a new topic. Until next time, stay safe and take care.